Good evening, Commonwealth, and thanks for watching the Channel 2 News. I'm Ashley McDowell. Let's take a look at tonight's top stories. Some individuals have completed their 14-day quarantine and are released to go home. Also tonight, the few returning passengers from Guam have landed as flights are suspended for the remainder of the month. And medical supplies and equipment for COVID-19 have been shipped into Saipan for first responders. Stay with us, these stories and more are next.
My family is on whole home Wi-Fi powered by Plume.
Since we installed the Docomo whole home Wi-Fi, what did you guys notice about it?
When you pull up the driveway, it automatically connects, and I don't have to get out of my car right away and come upstairs to go on my phone.
My favorite thing is that it doesn't buffer when I'm watching YouTube.
My favorite thing is that when Addie calls now, there's no lag. Like before, it used to be where I couldn't see her sometimes and I have to hang up and then call her back, and now I don't have to do that.
You know what's a good thing too is that when you come over to visit, I could give you your own password. I can assign a time limit so that I can say that you can only be on it for 1 hour, so that means you won't get in trouble from your mom.
And then you could go home.
The thing that I love the most is that I can freeze the internet for periods of time so that we can enjoy dinner time like this. Why are you rolling your eyes? So I'll turn it back on after dinner. Whole home Wi-Fi powered by Plume. Docomo Pacific, better together.
Hafa Day, Tirawami, and good evening, Commonwealth. Today is Monday, April 6th, 2020. The first batch of individuals that were quarantined after travel have been released to go home today, and there have been no new confirmed COVID-19 cases. Take a listen. As of today, April 6th, there are 8 individuals that have tested positive for the coronavirus in the CNMI and 1 death.
So we have 8 positive confirmed cases here in the CNMI. So far, we've sent about 34 specimens to the Guam Public Health Laboratory. Of those 34 specimens, 24 tests have been completed, resulting in 16 negative cases that have came out of those results. And we have about 9 to 10 pending. CHC continues to monitor the situation in which we are going to be sending some additional specimens to Guam. We understand that Guam has been backed up with a spike in their cases, especially as of yesterday when they had a spike of cases. What CHC and the governor and the task force has been doing proactively is to ensure that we look at other means to find testing results as much as possible. So we are working with Hawaii through the diagnostic laboratory to ensure that we can get our specimens over to Hawaii to get testing done over there if Guam is not available.
Kanoa Resort and PIC continue to be the sites of quarantine for individuals who have tested positive for the coronavirus and for individuals that have traveled into the CNMI that must undergo a 14-day quarantine as part of the governor's directive. Bautista says 39 individuals have been released from quarantine today as they have completed the 14-day requirement with no symptoms of the virus.
So far, we've, as of Sunday, April 5th, at 5 p.m., we have about 224 people under quarantine. at the Pacific Islands Club, where we have a majority of our travelers who are under the mandatory 14-day quarantine. We have about 184 travelers, quick note, including my brother. And Canoa Resort, we have about 40 in isolation. I want to be really clear about that 40 number at Canoa Resort, about the isolation. What we're doing is that we're keeping folks who are symptomatic, who meet the person's under investigation criteria, and we're isolating them for their safety and for the community safety. As a precaution that the task force and CHCC has come together on medical expertise to ensure that we can keep folks that may have contracted the COVID-19 isolated, contained, and treated with the medical professionals as they do. Over at PIC, we have travelers every single day being monitored by CHCC medical professionals. They get a temperature reading. They are enrolled within the text illness monitoring system, where they get a text message once or twice a day, checking on their symptoms. Over at Canoa, again, going back to those 40 folks that are in isolation, this includes the 7 that are confirmed. We know that we've had that one passing about a week ago, but we have 7 folks that are positive confirmed, including through the contact tracing, their family members, friends, personal contacts, and associates that they may have they may have had close contact over the last 14 days.
BioFire test kits were flown in over the weekend as part of a request from Governor Torres. This will allow for CHCC to conduct tests on island. But Bautista says CHCC must ensure the lab is in compliance with specific standards before the test kits can be used.
When it comes to this BioFire test kits, it requires us having to repurpose the lab, making sure that it's in compliance with what's happening, with the criteria through the U.S. CDC, and ensuring that U.S. test kits as well as international test kits that we are procuring as well matches up with CDC and WHO standards.
Bautista says the 7 individuals at Canoa Resort that have confirmed cases of COVID-19 are in stable condition. The COVID-19 task force asked every individual to keep social distancing and practice hygiene as if every individual has the virus. Reporting for KSPN, I'm Ashley McDowell. These CNMI retirees are getting a 25% cut. Governor Rob Torres says the decision was made due to the PSS injunction. In an open letter from Governor Torres to all government retirees, surviving spouses, and minor children beneficiaries, Governor states starting on April 15th, the next scheduled payment to retirees, the CNMI government will not be able to obtain funding to pay 25% of their pension. In the letter, Governor states he and Lieutenant Governor Palacios, Secretary of Finance, and members of legislature invited PSS and the Board of Education to discuss the financial situation. Governor states they met on 2 different occasions and that he informed PSS that the injunction would result in a 25% cut in the retiree's pension. Governor says, quote, "My hands are tied and any ability I have to guarantee you your funds has now been ripped away," end quote. Governor's letter continues by stating his decision was made to cut retirees' pension by 25% because of actions taken by members of the Board of Education. Governor Torres says in his letter, quote, "I am sorry that certain members of the Board of Education's only commitment is to selfishly guard its interests at the expense of our community. I am sorry these acts of self-interest have led to this difficult decision," end quote. Governor ends the letter telling the retirees the community must fight against, quote, "self-interests and work toward bringing forward a community that puts the needs of others before their own," end quote. The CNMI is now a bit further from Guam and the rest of the world, as scheduled air service has been cut for the rest of the month. Our Chris Nelson reports.
The last scheduled flight into and out of Saipan for April happened yesterday morning when United arrived and brought a few returning passengers in from Guam. About 70 passengers departed on the flight out, many of them FEMA personnel who have been on the ground the past few months helping with Typhoon U2 recovery efforts. Airport now basically empty, a couple of staff here and there to service these last few customers. The arriving passengers will be quarantined for 14 days, part of the governor's directive that was put into place before there were any confirmed COVID-19 cases. Now that officials believe there is community transmission, the 14-day quarantine for arriving passengers seems less urgent. One family, though, didn't let the quarantine directive get in the way of welcoming home their dad, who's been on Guam for medical reasons the last couple months. They made sure he was able to see them on his ride to the facility with signs like "Stay strong" and "We love you." The family was happy to have Phil on familiar soil. Chris Nelson for the Channel 2 News.
More tonight from our Friday interview with Esther Muña, who says local lab testing remains a challenge. Some of the infrastructure is here, but it's still a challenge to get the kits here, and the types of tests are changing. Our Chris Nelson has more.
The testing situation as of now, you mentioned testing people who are dealing with patients every day, our frontline healthcare workers.
Yes.
Are we able to test them? How many test kits do we currently have?
So when we say we have the capability, the answer is yes, we have the capability, but we need to make sure that we have the swabs, the nasopharyngeal swabs to be able to collect the specimen. And even that in itself is also running out of supplies. So that's the reason why there's EUAs, the emergency use authorizations, have been given to other equipment so that other equipment can be utilized. And those equipment are on CHCC, and some that are basically on its way over here as well. So
does it mean testing, when you say other equipment, does that mean like testing that may not be FDA approved, like testing from Korea or China? Is that what you're talking about?
So there's several things that have been happening since January 20, which is number one, we purchased the BioFire. We were expecting that it was going to get an EUA, and it did. We expected. We also have the Gene Expert, which is every U.S. APIs have that. We are part of that grant from Department of Interior to include Rhode and Tinian as well to get their own Gene Expert. That is for TB testing. So we already have that. So now they actually have cartridges that are available and testing kits that can be utilized in the same equipment that is available in that. So these EUAs are granted by FDA right now because of, the availability of testing all over the world. And so, with the Trump administration saying, let's go ahead and issue these have the manufacturers design the testing kits for these specific equipment so that anyone with those equipment can be able to do the testing. So unfortunately for that is that while these equipment are here, you have to manufacture the testing kits. You have to manage, and right now at this point where the United States of America is, with their apex being so high, you're looking at that, and it's basically the demand is higher. So now we're slowed down. Even though we have the equipment, the testing kits may not be available. But we're working directly with DoD. We're working directly with FEMA. We're working directly with HHS to see other options. And the latest equipment that they've basically given a EUA is the Abbott, which is more rapid testing. I believe it can give you about 15 minutes results rather than what's happening right now with the ABI 7500 in Guam. So
when do you expect that we could utilize that? Do you have an idea of when that would be available here?
So to be honest with you, we started out with ABI 7500, and we were thinking, okay, this is it. We renovated our lab. We got we purchased the equipment. It's on its way here. We need calibration. We need training for our staff on how to do this. Those are things that are in the works. Then we have everything else also in the works. Right now, it seems more probably faster of all the things that are in the works. The more realization is really the Abbott testing, which is the testing kit. It looks like that, but it can change tomorrow. Like, we often kid around, and it's like everything is evolving. And I think this is, in some ways, this is also evolving, right? But there's also so those are things that are FDA approved. They are all FDA approved, these equipment. We can use them for diagnosis. We can use them, for example, if they come to the emergency room or if they're admitted to the hospital, we can clearly say, yes, they have COVID-19. The percentage of accuracy is high. On the other hand, there is those that are available in the western part of the world, right? I mean, west of us. Those are rapid test kits that could be used for surveillance, and that's exactly what we're doing as well. We're trying to get those equipment here so that we can do some community-based testing to identify really what's in our community.
So you take
First
one of
priority.
those Asian rapid tests, you test somebody, and then if it looks like they're positive, then you would quarantine that person right away and
Correct.
follow up with
Right.
a test or something like that.
Exactly. You prevent the spread. Going back to how long it's going to take, it's the same thing. We've made our orders. We've requested. There's a lot of things moving right now with, from, like I said, from the governor's, task force, as well as, himself and the DOD and whatever support we can get from FEMA. Those things are in the works, and I just don't want to say, it's going to be here at this time. We'll just have to wait and see. But at the same time, we're trying to make sure that we have adequate supply now here.
What is our local ventilator situation, and have we had to use any ventilators yet?
We are using one ventilator. That's but yes, the numbers, I know I've seen them posted in many places. That is correct. We have 16 adult ventilators, one child, I believe one child ventilator. We have those ventilators. It is, if you look at our population, yes, the numbers don't add up.
On the ventilator side, how many ventilators do you think that we need when you look forward? What would you be comfortable with?
Based on our population, we are talking about several hundreds of ventilators. But let's go back to that. People think the answer is ventilators. There's also resources. There's also staffing. There's also beds. And those are the things that we're working on, and in the next few days, in the next few weeks, you're going to see some things that are happening right now at CHEC that are going to change. So
does that mean new equipment coming, or personnel, or what's going to change?
Well, let me just tell you, personnel, unlike you two, remember when you two came, we had, we looked at Tinian, what happened in Tinian, what happened here in the southern part of the island, and we've identified resources. WHO was responding, we have the federal government responding. We're not the only one, right? It's not like you two. So it's going to be more difficult to get personnel because they're all over the place, and globally. And then you also look at, so we are trying, this is one of the things, again, working with the COVID-19 task force and the governor is really trying to see, what are our options? If this can deliver it, go get it, It is not a matter of money anymore.
We've seen some projections for the U.S. and they look at different cities and the talk about when the virus may peak in different areas. With what we know today here, where do you see us peaking?
I don't want to comment on that right now, simply because we haven't completed our contact tracing and looking, and to be honest with you, I think the actions that the governor has made, which is, if you compare us with Guam, and I'm not, I don't really like to do that, but if you compare what the governor has done here, we are trying to contain it, right? We've already identified it. We're working on making sure that we have the availability to diagnose, treat the patient. We are isolating the patients or the individuals that we've identified, and we're doing our surveillance. We're doing all these things all aligned to make sure that we try to prevent the crisis. I'm not going to guarantee that, but there's steps that have been taken, whether it's from the task force, whether it's the governor himself working with DOD or anywhere else, and our team that is, and I gotta say that I am just so fortunate, and we are so fortunate to have great people here at CHEC and entire CNMI that are really, putting themselves at risk and really just saying, I'm going to do this, because if I don't have that, we might as well just say we're doomed. But because of the fact that nobody wants that, and everybody is participating, and I'm very, very, very grateful. Everybody has a responsibility to do the right thing. Whether you're the employer, you're the staff, you're the customer, we all need to do the same thing. And again, going back to being a community, don't hate. It's everybody's trying to do everything they can. Please, if you see a healthcare worker and even a health screener, these people that are in the front protecting the healthcare workers out there, screening and interviewing you and taking your temperature, those are people that we need to thank, and they haven't been thanked enough. So I really hope that happens.
Over the weekend, FEMA, the U.S. Department of Health and Human Services, and the U.S. Department of Defense shipped in much-needed medical supplies and equipment for COVID-19 response. On Saturday, Governor Ralph Torres, Lieutenant Governor Arnold Palacios, CHCC CEO Esther Muña, members of legislature, and members of the COVID-19 task force were at the Saipan International Airport, awaiting the arrival of the U.S. Air Force C-17 Globemaster aircraft, bringing much-needed supplies that will be provided to first responders.
We have PPEs, which is personal protective equipment, masks, gloves, gowns, some other equipments, and of course that'll be going to the hospital for our nurses and doctors and first responders that are dealing and handling with the COVID-19 illness or virus.
Also provided is a 50-bed federal medical station from the Strategic National Stockpile and lab testing capabilities with BioFire test kits so that Saipan will be able to perform tests in the near future. Governor says although supplies are short around the world, orders are continuing to be made to ensure first responders are given the necessities during this trying time.
It'll be enough for a certain period of time, but we've been ordering also PPEs from other vendors, and as well as all of this have been pre-approved with FEMA, as well as our hospital, CHCC, and the task force. So we've been making orders across, and I know that the problem that we're having here is supply. We are basically fighting with the rest of the nation or the rest of the world, but we continue to work with our partners as well as FEMA, DOD, and of course our private partners here on the island.
Coming up, some amendments have been made to the governor's executive order. We tell you what these amendments are after the break.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. I'm in love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Winigi PHI Pharmacy in Gofadahi, Ihinim Lomo.
Our complete line of pharmaceuticals and lowest prices ensure you get the treatment that you deserve.
Our compassionate, friendly, multilingual staff will take the time to get to know you, explain your medications to you, and answer any questions that you may have.
Ngere ayor sumaye ukalweres ren, kutsu wayor safeye emal ebalisyu klalyam weres.
Inumin ng inyong gamot ayon sa inireseta ng inyong doktor at alinsunod sa bilin ng inyong pharmaceutical.
We accept most insurance, but in case you don't have coverage, we offer cost-effective generic drugs.
PHI Pharmacy, your lifelong partner in health. PHI, the pharmacy you can trust.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. I'm in love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Welcome back to the Channel 2 News. Governor Torres has made a few amendments to directives of the Executive Order 2020-04. Directive 14 closed all public beaches and pathways. But Governor Torres has amended the directive to allow for only individual use for exercise and wellness, both physical and mental. Also, shoreline fishing is allowed as long as social distancing is maintained. In a release from the Office of the Governor, it states after consultation with the COVID-19 Task Force and the U.S. Coast Guard, there is enough enforcement of boating safety operations to lift the restrictions. This means boat ramps and docks are reopened on Saipan. All activities may be practiced from 6 a.m. to 6 p.m. as the curfew remains in effect. On Guam, the first group of sailors aboard the USS Theodore Roosevelt have been transported to their quarantine hotel. KUAM reports.
Half a day CNMI, here's what's making news on Guam. The move of sailors from the USS Theodore Roosevelt into hotels in Tumon began Thursday night. The transport of negative COVID sailors is a result of several days of negotiations between the government of Guam, the military, and the Guam Hotel and Restaurant Association. Sabrina Salas-Montanani with the latest on this massive operation led by the Department of Defense.
According to Joint Region Marianas Commander Rear Admiral John Manoni, the first group of almost 200 sailors aboard the USS Theodore Roosevelt have already been transported to their quarantine hotel in Tumon, with another wave set to embark off the ship.
We are targeting being able to move another 300 to 400 sailors within the next 12 to 24 hours.
Only sailors that test negative for COVID-19 will be shuttled and lodged in designated quarantine hotels along Tumon Row. According to GHRA President Mary Rhodes, all mitigation efforts were negotiated over the last several days for the quarantining of up to 3,500 sailors.
This has been a really big operation to get to our 3,500 number.
A number that also required the transition of guests out of DoD contracted quarantine hotels into other accommodations. Rhodes adds that the quarantine hotels, an estimated 8 total, will be stood up and manned primarily by military personnel with strict rules that each sailor be confined to their rooms.
They have pulled resources from within the fence of different military branches and agencies to even outside the fence of Guam Army National Guard. And so we have whole teams of 30 up to possibly even 50 teams per hotel that would be assigned. And that's for the minimum 24-hour daily. So that's not even relief teams. And so that would be the teams that would be assigned to provide different kinds of services.
This includes security, enforcement of the hotel perimeter, floor monitoring, and food delivery. Each room also will be pre-staged with a case of water and linens to eliminate the need for housekeeping services.
They are not given even key cards. They are not to leave the room. If they were to leave the room, it's already notified through monitoring of the floor monitors with enforcement, and they are subject to penalties.
Additionally, the COVID-negative sailors will also be subject to daily medical evaluations.
To make doubly sure that we're doing everything in our power to protect our military civilian team here on Guam, to not contribute to the spread of COVID-19, and to preserve the warfighting readiness of our force.
As for whether there are plans for a designated isolation facility off base for sailors who test COVID positive, Rhodes says absolutely not.
Everything will be staying inside the fence. They've already taken over buildings and have started addressing those concerns within their facilities.
Reporting for Guam's News Network, I'm Sabrina Salas-Montanani.
Stay informed 24/7 by checking out KUAM.com or downloading the KUAM News app available for iOS or Android. Reporting for Guam's News Network, I'm Adriana Cotero.
Stay tuned, because after the break, we have your weather report.
Green sea turtles and hawksbill turtles call the Mariana Islands home. They're an important part of the marine ecosystem. They are under threat, and they are protected under CNMI law. Keep plastic out of the ocean. Keep vehicles off the beach. Use the Sea Turtle Stranding Hotline if you see poaching activities or if you see a turtle in trouble. Call 287-8537 and save a turtle.
My family is on whole home Wi-Fi powered by Plume. Since we installed the Docomo whole home Wi-Fi, what did you guys notice about it?
When you pull up the driveway, it automatically connects, and I don't have to get out of my car right away and come upstairs to go on my phone.
My favorite thing is that it doesn't buffer when I'm watching YouTube.
My favorite thing is that when Addie calls now, there's no lag. Like before it used to be where I couldn't see her sometimes and I have to hang up and then call her back, and now I don't have to do that.
You know what's a good thing too is that when you come over to visit, I could give you your own password. I can assign a time limit so that I can say that you can only be on it for 1 hour. So that means you won't get in trouble from your mom.
And then you can go home.
The thing that I love the most is that I can freeze the internet for periods of time so that we can enjoy dinner time like this. Right, rolling your eyes. So I'll turn it back on after dinner. Whole home Wi-Fi powered by Plume. Docomo Pacific, better together.
And here is today's weather report. Today we have a high of 90, a low of 78, 64% humidity. Tomorrow, partly cloudy with isolated showers, east winds 10 to 15 miles per hour. Tomorrow we'll have a high of 88, low of 78, seas 5 to 7 feet. High tide at 6:43 a.m., low tide at 12:26 p.m. Sunrise will be at 6:08 a.m. and sunset will be at 6:30 p.m. And we want to say thank you for watching our Monday edition of KSPN2. Have a great rest of your evening.